Hi, my name is Svea Closser, and I'm a professor here at the Johns Hopkins Bloomberg School of Public Health. I'm really fortunate to be here today with two experts from two different countries in our consortium working on this project. We have Malabika Sarker from Bangladesh and Akinyemi from Nigeria, here to talk about the importance and strategies for engaging national governments in disease control programs. Thank you so much for being with me today, and I really look forward to hearing from your expertise. So let's start with the obvious question. Shun, can you start us off with what's the importance of engaging national governments if you're trying to do a global disease control program?
Thank you very much, Svea. Engaging national government is very, very important in ensuring that a polio program or any program at all works at the end of the day. One important reason why it's important to engage national government is for sustainability. Many times when donors come, eventually with time, they pull out. So if national governments have not been engaged, they will not be invested in the process to keep on funding the program. And another reason is to ensure ownership of the project so that the country can see the project as theirs and not just what some people are coming to do from outside. And the third important reason for me is that to improve confidence of the people, because many times when the community members or citizens of a country, when they don't see their national government leading a project, they are kind of skeptical or on why these people are coming. But when they see their national government leading the process, there is confidence. And this is very, very important in ensuring ownership, accountability, and then sustainability. So I think that is very, very important to engage national government in any program.
Yeah. Just to add what Dr. Sun said, that it's also important that only the government can scale up a program. It's no other private or NGOs or faith-based. Only the government can do that. And for that reason, it's very important to have a responsive public health policy or the public policy, which can ensure the inclusion and also the equitable, like delivery of the service. And only the national government can do that. And so it's very crucial. I agree with completely Dr. Shun that it's very, very important to include the national government in terms of the strategy and also the strengthening the partnership.
Yeah. So how do you do that? As a if you were working for the WHO or UNICEF, one of these big agencies that are global and working on polio eradication, what are some great strategies for engaging national governments?
I think the key for engaging is that to ensure that the national government understands that it's a shared vision. It's not something that is imposed by the external forces. So as soon as the government realizes that it's a shared vision and there's a mutual respect to each other and it's in alignment with the national policy. So definitely sometimes, of course, the government might have different priorities, but as soon as that, I strongly believe that the government realizes that it's a shared vision and with mutual respect, they will be keen to be part of that. But at the same time, it's very important to develop the capacity of the government. Whenever we come with a shared vision or an objective, we need to look critically that, okay, how much capacity building is important and whether it's necessary, and to engage government and involve in the capacity building.
In addition to what Malabika said, I want to add that when engaging national government, you should do that right from the beginning, right from the planning phase. So we often talk about community participation versus community involvement. You don't want to involve people when you have done all the planning.
Right.
So you want to bring them on right from the planning. And just like she said, so that the planning will be contextual. You factor in the priority of the government, and then you design the program together. With that, they will feel a sense of ownership, and they will be able to take it forward, even when the donors are ready to scale back.
Yeah. So there's a real challenge in this. I think all of what you've said makes complete sense and is very, very important. There's a challenge in an eradication program because you have to get every country on Earth to be involved at the same time. And so, what do you think about some of the challenges of that? I mean, chances are there'll be some government that isn't aligned with those priorities or maybe is consumed with other problems. What can you do in that situation? Or is that just a problem with the goal of eradication? What do you think?
Again, that shared vision, mutual respect, and sense of ownership is important. But here, we also have to realize that the stages of eradication is not same in each country. The countries have a very different sets of problem. Some countries is almost eliminated. There's the question for the sustainability. There's a country still suffering from endemic polio eradication. So the objective or goal of the program have to be realistic and context specific. Then we can go to different countries and make sure that the countries can participate, because we should not have a blanket approach that every country have to eliminate by 2021. So that if we are very sensitive about the context and the problem and the capacity of the government also, and then I think each country can take participant, and then we can achieve the realistic goal and the approach. Yeah.
In addition to that, I think there are some organs of the UN through the World Health Organization. We talk about the World Health Assembly, where all the countries of the world are participants. They send their ministers of health. I think through such organ, we can ensure that people have a buy-in. Although when they get to their different countries, these things have to be domesticated.
Right.
But at least through such organ, it's very important. You can discuss, people can raise objection, they can talk about their own preferences, and then things can be fine-tuned, and then it can be domesticated in individual countries. So I think that's very important.
Great. Well, thank you both so much. This has been incredibly illuminating, and I really appreciate your time. Thank you.
Thank you very much.
Thank you.
Thank you.